Mr. President and colleagues in the Senate, last month, Democrats and Republicans joined together to increase the state tax on cigarettes and tobacco products. Our goal was to discourage smoking by young people and encourage everyone hooked on smoking to quit. There are already signs of progress. Calls to the hotline have doubled in the past week after the bill was passed. And an individual, Alex Foster, an 18-year-old community college student, was quoted in the paper as he said, when he decided to quit, he said, "Price was a factor, a major factor. I'm already feeling like I can breathe a little bit easier." Our decision to discourage smoking is already improving the health of Iowans. And by reducing the number of smokers, we are increasing the health of Iowans everywhere. And today, that decision is going to result in another health care benefit, this time by providing $127 million to the Health Care Trust Fund, which will improve the health of Iowans. As the law clearly states, the trust fund, and I quote the law that we passed that day, shall be used only for purposes related to health care, substance abuse treatment and prevention, and tobacco use prevention, cessation, and control. Earlier this week, Senator Putney asked if he had made a mistake in voting for the cigarette tax, because an editorial in his hometown questioned why the minority whip would vote with a Democratic majority. The editorial in the Renback Courier stated, "When has the majority followed through on any of its promises?" Senator Putney, I'm here today to tell you that you have nothing to fear, because we kept our promise. Today we are going to release the spending from the Health Care Trust Fund, and all of the $127,600,000 of expected revenue will go to health care as we promised. Senate Republicans Putney, Butker, Gaskell, Noble, Ward, and Lundby, and 28 Democratic senators should all be thanked for the vote that you took to increase the tax on tobacco products. This was a bipartisan vote, working to ensure that Iowans don't start smoking, and those that have started, that they can quit. This is a noble motivation. Coupled with targeted appropriations to Medicaid, tobacco cessation, expansion of health care access for all Iowans is a noble outcome. At noon today, the Health and Human Services Budget Subcommittee will meet. We plan on approving the Budget Committee recommendations that will plow money back into the cigarette or health care trust fund as we promised, and it will go toward improving the health of Iowans as we promised. A few highlights. Almost $9 million will help people avoid getting hooked on cigarettes and tobacco products. $3 million to community health centers, free clinics, rural health clinics. $9 million to help children get insured under Hawkeye. $9 million to expand the coverage to parents whose children are eligible for Medicaid. $4 million to expand Medicaid enrollment for children. $7.5 million for mental health coverage. The list goes on, and it goes on. For $127.6 million, it goes toward health care, substance abuse for every Iowan that we can reach. Yes, we must admit, it took too long for us to listen to Iowans. It took too long for this legislature to act to discourage smoking. It took far too long to start recovering some of the hundreds of millions of dollars that tobacco and cigarette smoking has caused for the health of Iowans. It took too long. But this year we got the job done. Fewer Iowans are smoking, and that means more families will live healthier. And the money generated from the cigarette and tobacco tax will go directly to health care. This is a good day, ladies and gentlemen. It is a day in which you could go back to your constituents this weekend and tell them that we did deliver on the promise.